I'm J.K. Baton, 40 years old. First and foremost, a cancer survivor, a father, a farmer, a hunter, and here today to talk about IL2 and Dr. Gerald Militella and my journey through treatment.
I was teaching a class of first graders when I got the text. Kidney cancer has to be out as soon as possible. And I just dropped the phone and there I had 20 little faces looking at me and crying and didn't know what to do, where to go. And I had an aide with me at the time and she said, just go ahead and go home.
They got scared. My son was 9, my daughter's 19, my wife a little younger than me. I didn't want to lose them.
And I know at the time I kept thinking, oh God, why us? Why us? And then after I prayed about it and talked to other people about it, why not you? Why is it all right for someone else and not you?
Made arrangements to see Dr. Garrett Lynch at Baylor Clinic in Houston for a second opinion, immediately. We saw, and he told us, come home to Baton Rouge and see Dr. Militella and do IL2. And I did.
Well, interleukin therapy, or IL2, is how most people know it. It's a type of immunotherapy when basically what this does, it stimulates the body's immune system to fight the cancer. Really should be first-line therapy for any of these patients with metastatic disease. The thing with the IL2 is that we know in 6 weeks whether or not it's going to help you. Really and truly, the heart of any of these programs is having the staff trained to assist me, and we have had a wonderful staff. They do a great job. They're very comfortable, and the patients love them. Working with nurses who've been doing it for 10 years makes all the difference. They can anticipate what's going to happen with the patient and try and prevent these side effects.
Without Corey and Brenda being there, I don't know if I could have made it through that.
Like JK and I, for the entire week, I spent 12 hours a day, 5 days a week, on 4 separate weeks. So we became more than just, patient and the nurse.
Young, like I said, his little boy's 9. He's got many more years to raise this baby. He's got his, fabulous wife, another daughter, in college. A lot of time left to spend with his family, and this gave him great results that I don't believe he'd have had otherwise.
I think the one thing I'd like to get across to everyone is that I'm passionate about interleukin therapy. I think it works. I think side effects are very manageable, and it's truly the only treatment that has the potential for long-term survival, and I just can't stress this enough. I think any patient who's a candidate for IL2, I think it's a disservice on our part not to offer them this treatment.
I was never a sick person. I did what I wanted when I wanted to do it and never looked back. And to be told that you had cancer, you needed some type of compassion and someone with understanding and willingness to get into the problem and help. Not someone that'll just give me medicine and send me on my way. I found that with Dr. Militella.
Right. No, he was not at home, and I kept calling. He wouldn't answer the phone. And actually, I got in the car and I drove around because I thought he was at the shop. And I started blowing the horn, and nobody's there. So I said, oh, shucks. So I pick up the phone, and he finally answered. I said, oh my God, the scans were awesome. I mean, it's gone.
I wish this staff could get treated by themselves to realize how good of a job they actually did. And that's the only way I could express that, would be for them to experience themselves. Just hope no one has to go through this because it's tough. Where I'm going to now, I hope to fall in these statistics that he's telling me that they're achieving with this treatment. And the statistics he's telling me are a lot better than what you're going to read by doing your own research. I'm looking at being clear of cancer for a very long time. I just want to live, and that has been my goal the entire time. I'm not ready to go buy a suit for myself.